Honourable Chairperson of the Commission, Honourable Commissioners, colleagues, state responses to COVID-19, including extreme lockdowns, have highlighted border closures and the resultant restrictions on population movement, have highlighted the essential role human mobility plays in and on the continent. As a result, COVID-19 creates a unique opportunity for encouraging states and regional bodies to centre mobility across international borders as part of a more holistic approach to inter- and intra-continental trade, development and the fulfilment of human rights. Yet, despite the prevalence of diverse forms of population mobility across the continent, responses to international borders. Ultimately, this involves facilitating the regular transfer of goods and services, while simultaneously restricting the regular movement of non-citizens across borders. This approach is detrimental to the management of COVID-19 and highlights the prioritization of protocols for facilitating the movement of goods and services over engaging with protocols that have been developed relating to the movement of people. These responses will further stall the agenda associated with the AU protocol for the movement of people. The response to COVID-19 has also provided states with the opportunity to tighten and restrict the movement of people across borders. Furthermore, in some contexts, COVID-19 is being used to legitimize an increasingly securitized response to immigration. As has been shown in previous research, closing or fortifying borders does not stop movement. Rather, movement across borders continues, but becomes more dangerous as greater risks are taken outside of regular channels. This has implications for the safety of individual migrants and for public health more generally, as people who move irregularly are often left out of disease control mechanisms at points of entry. COVID-19 has affected migration routes to Europe, with more people moving and more dangerous routes. Key areas of concern include transit camps in Niger at the border with Libya and Algeria. Increased securitization of immigration may undermine the much-needed efforts to develop migration-aware and mobility-competent cross-border regional health systems responses. Therefore, there's a need for caution as the development of immigration interventions centered around a securitization approach may provide opportunities for co-opting components of the global health security movement by using health status or perceived health risk as an additional securitization measure. In order to ensure that the continent leaves no one behind, responses to COVID must mainstream all forms of migration and all migrant groups. This includes those moving within their country of birth, as well as those crossing international borders. To this end, we urge the African Commission to encourage states...
Your time down.
Okay, thank you.